Module 12, Read-Only Access to CareLinkSF ECW. Welcome to CareLinkSF. CareLinkSF is the electronic medical health record used at the San Francisco Department of Public Health community and hospital-based clinics. eClinicalWorks, ECW, is the program CareLinkSF uses. The purpose of this module is to give you a basic understanding of how to access patient information in CareLinkSF. By the end of this video, you will be familiar with the policy, Electronic Health Record Read-Only Access to eClinicalWorks, ECW. Be able to log in and out of the program, look up a patient, access the patient hub, view test results, view visit notes, view patient medical and social history. Consistent with HIPAA regulations, end users are expected to use the system only to access information necessary to perform patient care-related activities. End users with read-only access will not enter documentation in the system, including marking as reviewed laboratory or diagnostic imaging, or entering other documentation or actions on these results, creating new telephone encounters, actions, or messages, writing addendums on existing notes. End users with read-only access will notify their clinic's medical director immediately if any clinical documentation is routed to them. End users accessing ECW will destroy any protected health information printed from the system after using it for clinical care needs. To log into eClinicalWorks, click on the eClinicalWorks icon. Log in with your CHN number or LCR user ID and password. Password $1 if you're accessing it for the first time. In version 10, the login screen will look like this. Depending on your settings, you will be brought to the resource schedule or the office visit screen. Both screens will display patients' appointments on a particular date in a particular clinic. To look up a patient and access their medical record, click on the search icon located at the top screen between the eClinicalWorks logo and the green buttons. In ECW, the search icon is also known as Sherlock, and the green buttons are called olives. Single-click on Sherlock, and the patient lookup window opens up. Search for your patient by name or medical record number. Before searching, use the pull-down menu to the right of the initial dialog box and indicate the qualifier you are going to search by. Then type patient medical record number or name with last name, first name. When RTS, or real-time search, is checked, results will populate as you type your search term. If necessary, narrow your search by using the second set of dialog boxes to the right. Again, choose the qualifier first, and then type in your search term. In this case, I am searching on the patient's name and birthday. To browse lists, use the Next button on the bottom of the screen. When you see the patient you are looking for, double-click on the name to open the patient hub, or you can click OK at the bottom. The patient hub opens up. The patient hub functions like a patient chart, containing all the medical information on a patient. The patient's name is displayed at the very top of the window. Below that are links to other parts of the patient's chart. Use the links on top of the hub window to access lab and diagnostic imaging results. Click on Lab to open the lab window. Use lab categories to narrow results. In this column, the F stands for future labs. C stands for current labs. The pink paperclip indicates electronic results. Gray indicates results that have been scanned in. You can review results by double-clicking on the pink paperclip, or you can double-click on the lab itself. On the lab results screen, patient information is on the upper left side. The provider is the ordering provider. Lab information is found here. lab, order date, collection date, and reason. Results is where the lab will be marked received, the date it was received, and any results. Electronic results will populate these fields. Click on the pink paper clip to view them in the other format. If point-of-care testing results are done, those results will be manually entered here. The assessment the lab is associated with is viewed here, as is additional clinical information, or in Add Notes sections, providers may add additional follow-up instructions to staff. Exit the lab window and return to Patient Hub. To return to the Hub, simply click on the X in the right-hand corner of any screen you've opened. To view diagnostic imaging results, click on the DI link. Results are organized and accessed the same as labs. Click on this tab to view immunizations and therapeutic injections. It's possible to view a history of immunizations, and it's also possible to see what immunizations are due. Click on the Allergies links to view patient allergies. Displayed below these links are the patient's demographics. Below that is the last and next appointment of the patient. The lower half of the hub contains more links to patient information, but for this session we will cover the following: encounters, medical summary and OB summary, patient docs, and the right chart panel. Click on the Encounters link. When the Encounters window opens, make sure that the pull-down menu next to the Encounters dialog box here is set to all. In that way, you are able to view the patient's future and past appointments as well as non-face-to-face encounters, also known as telephone encounters. In the Encounter window, you can see the date of the encounter, the time, the provider, and the reason for the encounter. From left to right, the lock icon indicates the progress note has been signed. The date and time indicates the date and time of the appointment. In the Type of Visit column, you will be able to see if the encounter was face-to-face or virtual. TEL is telephone encounter. Any type other than tel is a visit type code used for that appointment or clinic visit. Provider will display who the patient was seen by in clinic, not necessarily the patient's primary provider. Resource displays the clinic the patient was seen in, which may also be the physician's name. The reason they were seen will be in the far right column. You can double-click on the appointment and you will see the progress note associated with the encounter. Medical Summary. On an OB patient, when you click on Medical Summary, there's a pop-up window that allows you to choose OB Summary. The OB Summary compiles information from the patient's past and ongoing prenatal visits in ECW. Choose the information you want to view using the left menu. You also have the option to print or fax the OB Summary. Patient Docs. Click on the Patient Docs link to view any scanned documents from an outside facility. You can also view progress notes from hard charts, consents, forms, or letters. Right Chart Panel. Also available from the Patient Hub is the Right Chart Panel, which contains patient information. From the Overview tab, you can view patient advance directives, problem list, medication summary, allergies, immunizations, and therapeutic injections. From the DRTLA tab, you can view lab and diagnostic tests that were done, procedures, telephone encounters, referrals that were made, documents, and actions. To access results, use the links on the Patient Hub. The History tab displays patient medical, GYN, OB, surgical, family, and social history. The CDSS and alerts alert providers to tests or procedures that may be due on a patient. This concludes Module 12, Read-Only Access to CareLinkSF ECW.